Mississippi. We're here for the Mississippi Medical Association and the Mississippi Food Network's food drive. We're pleased to welcome now Dr. Thomas Dobbs, Dean of the John D. Bower School of Population Health, and Dr. Victoria Gholar, Assistant Dean for Student Affairs at the John D. Bower School of Population Health. Dr. Gholar also serves as the Executive Director of the Merle Evers Williams Institute for the Elimination of Health Disparities. Dr. Dobbs, Dr. Gholar, thanks for joining us today.
Thank you.
Yeah, thanks for having us.
So let's start out with the food drive. I mean, it's a pretty good deal that the Mississippi Medical Association is doing in conjunction with numerous private sponsors, and this is just a way for the private sector to also get involved and address this issue of undernutrition in our state. Dr. Dobbs?
Yeah, no, absolutely. It's a great opportunity to contribute to people who are suffering from hunger during the holidays. And we're going to be out here in the Kroger parking lot. And, I think there's opportunities to give money and also to give food.
Yeah.
And y'all are going to go, we're going to be here for a long time today, right?
Yeah, I think so, till 6 o'clock tonight.
Oh, fantastic.
Yeah.
Fantastic.
So we got the big SuperTalk RV parked in the parking lot. Can't miss it. And right behind it, next to it, I should say, is a truck that is there to collect all the food donations today that will get then distributed to those who need it. Dr. Gholar, why do we even have this problem in 2024 in our state, in our country?
It's so unfortunate this problem still exists, but there is very little access to food, believe it or not, even in our urban areas. We need to be more cognizant of this for individuals in our state as it relates to their health and their health care and their health outcomes. So thank you so much for doing this for us.
Yeah, absolutely. Now, I think we got a little mishap there with the wind blowing over our sign. So,
yeah.
So I think a lot of people would ask, though, Dr. Gholar, that we have all these various programs, federal, state programs that are designed to provide assistance to those in need. Why does that seem to miss the mark and fall short?
Well, there are sometimes individuals who have trouble with accessing those programs.
Okay.
So believe it or not, it's not just easy to say I need to receive SNAP benefits. We have low literacy levels in Mississippi, and you have to read applications and you have to complete applications. So sometimes that can even be a barrier for individuals. We also need to have access to computers and internet to be able to apply for those things. So it's not just simply saying I need SNAP or I need WIC. We have to have access to be able to do those things too.
And there's it only goes so far. Groceries are expensive these days, super expensive. And, we know that, most men are not eligible for SNAP, working age folks. Mm-hmm. And then, what I spend at Whole Foods and Corner Market and Kroger, what I would spend on a day sometimes would eat up somebody's whole budget. And that gets to the whole issue of how expensive healthy food is compared to food that's not so good for you.
Well, that's a question, isn't it, Dr. Dobbs? It seems like the food that's more nutritious, that's better, that's healthy for you, actually costs more than the food that's not. And that's where the impoverished tend to gravitate to the less healthy food.
Which makes sense if you think about the number of calories you get for the number of dollars. There's a story that I tell when I give some of my lectures that a few years ago, you remember the Amanda Holyfield meal deal?
Yeah.
Remember that? It was like it was a chicken and a burger and a fry and a big thing. It was $4. Right?
Yeah.
And so that same day I saw that billboard and I went to Whole Foods.
Right.
And I bought an organic avocado. And when I went through the checkout and I clicked it, do you know how much it was? $4.
Yeah. Well, the organic varieties are more than the non-organic, right?
Yeah, they really are. So, I mean, it just speaks how much, what a disparity there is in the cost. And so you can see it doesn't make sense for folks to spend their money on that. And there's a lot of reasons for that. But if, part of what we do with Dr. Gholar's team is try to make sure people have access to healthy food, even if they have limited food options.
Okay. And what about the so-called food deserts, Dr. Gholar? Are those prevalent in our state?
Very prevalent. They are even prevalent in Jackson. So just last year we had a grocery store close in the 39213 area. So now where are those individuals going to get groceries? Food deserts are everywhere in Mississippi.
So what can we do about this, Dr. Dobbs? I mean, I'm a person who doesn't want to rely so much on government programs. I think a lot of people feel that way. How can the private sector work together to address this problem?
Yeah, I think one of the things you can do is come give food today, right? We can make sure we give food for families to make it through the holidays. A lot of it's around our federal policies. We subsidize corn, soybeans, and stuff. And I'm not trying to say don't do that, but we drive down the cost of unhealthy foods, and it'd be great if we could have a way to make fresh produce and stuff more widely available. But also too, there's other options. I know with Dr. Gholar, we have a nutritionist who works there full time to try to even find ways to use things that are relatively inexpensive and also in a healthy way. Canned foods, lots of sodium, that sort of thing. There's what we could do to make healthy food cheaper would be great.
What about at the John D. Bower School of Population Health? What sort of work are you guys doing to address this problem?
Yeah, mostly we're working through the Merle Evers Williams Institute, where we actually do food donations, we do drive-throughs. We do work with the Mississippi Food Bank. We're actually one of their partners to make sure we get stuff out there. We do a lot of education, but we also, if you think about folks who are food insecure, sometimes it's because they have cancer. We have a lot of folks who come to get help because they have cancer, they can't work, they're on chemotherapy, and they need good nutrition. Other people with other chronic illnesses, a lot of the referrals we get are kids, right, Vicki? I mean, that's our biggest number of referrals.
Absolutely. Biggest number of referrals are for pediatrics. We also have lots of referrals for patients living with HIV, and we have several referrals for individuals over the age of 60, which is a big population of people in Mississippi that are food insecure.
Yeah, 20%, I think, of people over 60 in Mississippi are considered food insecure. And, on fixed income and stuff like that, I think we can imagine how that could be.
Wow. Dr. Gholar, how much of this could be addressed or should we be addressing with just education?
Lots of it, and people don't know what they don't know.
Sure.
So at every opportunity that we have to educate our patients, our community, we also have community food drives once a month, every third Wednesday of the month, in collaboration with the Mississippi Urban League, where we provide education to people in the community so that they can understand the options of having hot dogs, a turkey hot dog versus a pork hot dog,
okay,
even if those are the only options that they have.
Okay. You guys were talking before we went on the air about something. I want to make sure you were able to talk about that, some of the efforts you have going on.
So, we really are trying to make sure that we bring access to folks having access to food through the Evers Care Clinic. We're hoping to grow that. We're at the medical mall. That's where we do our stuff. So we do serve folks out there and a lot of people through the UMC community. But these are things that can be done, across the state. There are food banks all over the place that we're able to sort of partner with, and the food bank does a great job. But a big part of that, like you said, is having individual donors. Like, if we want to let, private sector and charity folks get involved, is to donate that money or those services. There's lots of great ones, Extra Table and a whole bunch of fantastic groups. So this is the time to give. If you can, I think now's the time.
Yeah, no doubt. We don't want anybody in our state to be hungry, especially around the holidays, in particular. But we don't want them to be hungry throughout the year. And you've probably heard us talk to Dr. Edney about what that costs from an economic perspective as well.
Yeah.
I mean, that's a big issue as well. I mean, it's hard to concentrate, hard to focus, hard to learn, hard to work when you're hungry. Is that basically right, Dr. Gold?
That is absolutely right. We have children in school who cannot concentrate because they're worried about having to take their lunch home to their siblings who are not getting food on a daily basis.
And we've heard this feedback from educators, from teachers in the classroom. They notice this, they observe this in their classrooms, but they're limited on what they can do about it.
Right.
We actually opened our on-site food pantry at University of Mississippi Medical Center because we had a patient tell us that it was not her turn to eat the night before. It was her brother's turn to eat.
Wow.
And that was not very long ago.
Yeah, that's sad. So, and the food pantries are a critical part of addressing this problem as well, are they not?
Absolutely. And then what I would like to say to our folks who are donating to food pantries, and actually it makes me think, Vicki, there ought to be like some guidelines for donating to food pantries, because sometimes things, there are things that we know are healthy we can help people get a hold of. But things like, canned corn and canned stuff like that, which is not necessarily bad, but there's plenty of that. It's got a lot of sodium in it. There are healthy ways to donate to a food pantry where we can have people select food. Now, one of the things that we're really excited about where we are at the medical mall is we a lot of times are able to get eggs. We can get catfish. We can get fresh vegetables, produce, greens. And part of what we do is either through the people who come through, we can educate them how to cook stuff maybe they've never had before. We had a whole bunch of avocados one time, didn't we?
We did.
And a lot of folks hadn't really had many avocados, so we had to do recipes for them.
Yes, we have. We've taught them how to make hummus.
Okay.
With chickpeas.
Wow.
And all of those other healthy options that they may not have tasted before.
I understand. Real quick before we go, Dr. Gholar, is there still a grocery store at the medical mall?
There is not. Well,
Used
there's
to be
a
one,
Save-A-Lot.
though, right?
There is
Okay.
a small Save-A-Lot
Okay.
right outside of the medical mall. Yes.
Dr. Dobbs, Dr. Gholar, thanks for joining us today.
Thanks for having us.
Appreciate it. Folks, we're once again in the parking lot at Kroger on I-55 in Jackson for the Mississippi Medical Association and the Food Network, Mississippi Food Network Food Drive. Pardon me. We're coming right back. Stay with us.